Welcome, my little couch potatoes, to the comfiest courtroom on the internet. I'm your host, Llama, and it's time for dramatic testimony, overruled objections, and absolutely unqualified opinions. So grab your snuggiest blanket, some delicious snacks, and get ready to watch court with your internet besties. This is Couch Court with Llama.
Bring the jury.
Hello, everybody. Happy Sunday night. It's not very often you get a nighttime llama, but you are in for a very special treat today. So, with me, I have Maggie. I say hi, Maggie.
Hello.
I can't see your
Hello,
face.
everybody.
That's a little weird, but hello. And we are here to talk about the Lindsay Clancy trial and mental health tonight. So, it is going to be hopefully an educational one, as there's a lot of misinformation kind of going on around the internet, which is some of it I've seen is very disappointing. But before we get into all of that, first and foremost, I'm Llama, as you know, and we have Maggie. Maggie, why don't you tell them who you are, if you don't mind?
Yeah, I am a psychiatric and mental health nurse practitioner. I have been practicing for quite a few years. And kind of my bread and butter is mood disorders, OCD, which is obsessive compulsive disorder, of course, ADHD. And I have treated women with postpartum depression and postpartum OCD. I have not encountered a postpartum psychosis in practice yet. It's very rare. 1 to 2 births per 1 to 2 cases per 1,000 births. So it's not uncommon for a lot of providers to not have firsthand experience with that specifically.
Yeah, for sure. That makes sense. When you get to some of those rare disorders and whatnot, I mean, they do exist, but you just may not. And that's like with other medicine, medical world too, right? You're not going to see everything in your practice in your time. And then for those of you that don't know, even though I'm pretty candid about it, I do have bipolar 1 disorder and anxiety. I had agoraphobia for many years. So tonight I will be speaking as myself on my experience with things, which is very different. And then Maggie will be speaking from a professional, though it is not any sort of medical advice.
Yes.
Correct?
Correct.
We're just having a conversation.
That is correct. I have not treated Lindsay Clancy. I only know what I have seen in the court case and the filings so far, and I'm not going to diagnose or give any medical advice tonight.
Exactly. But we're here to have a conversation because I haven't been watching the entirety of Lindsay Clancy's trial because I knew it was going to be very hard for me to watch, but I knew it was important. But I've watched trials that involve children and I'm not okay afterwards. So I decided not to stream it, but I knew her case was going to be very important because Lindsay Clancy is not a one-off. There are women that have done the same thing and still are. It's not just Andrea Yates and Lindsay Clancy. There's many other women who have been through something similar. And I was very interested in what the conversation was going to be around this trial. I was hoping it was going to enlighten people about mental health, because if you've never been through it or you don't have a loved one that's been through it, one, you are blessed, and I'm glad, because it's awful on both sides. It can be very, very hard. But I was like, oh, like this might bring some like really good conversation for mental health awareness. And it has, I think. But then there's a lot of stuff that it hasn't done. It went a direction I was not expecting it to at all. So I watched the opening statements a few weeks ago, and wow, those were something. I was pretty upset with the state. I felt like there was a lot of stigma being put out there in general. And no, the jury has not come back yet with whether she's guilty, not guilty by reason of insanity. We don't know that. We're not the jury. But it was some of the rhetoric that was going on that I was like, this, if somebody out there was watching and we're having thoughts or was in a crisis of some kind, and they heard some of these things, that person is probably not want to go get help.
Mm-hmm.
Um, and then when you hear people talk about the events and how those all played out, well, that may discourage people from getting help. But I don't think that's the case. Our system's not perfect, and I plan on talking about that with you tonight.
Mm-hmm.
Uh, because yes, it could be a crapshoot. It can very much be
Yes.
a crapshoot. It's not like other areas of medicine where, oh, here's a blood pressure pill and you'll be fairly good. It's still messy and it's still complicated. But let's start first, if you don't mind,
Mm-hmm.
talk about, because one of the things I think a lot of people don't understand is when a person is experiencing a mental health crisis, particularly if they've never gotten real treatment for one before. And if we can talk about how difficult that can be, both as a person with it and both as a provider, because I feel like this is the starting point
Mm-hmm.
of the story here is she's in crisis, allegedly, according to the story. And it can be a lot. It's called a crisis for a reason.
Yes. I mean, she's struggling. And I think one thing that has maybe come up, especially in her ex-husband's testimony, is there was probably some baked in internalized stigma from the get-go. Even before she had this crisis, it sounds like she did have some anxiety after her second child, I think.
Yeah.
And it sounds like she didn't really require medication, or she was able to manage it
Mhm.
without seeking care. And so, I feel like maybe she's coming from an area where, for whatever reason, whether it's people external to her as well, or just her own internalized of, um, you know, I just got the feeling it took a lot for her to reach out and get help to begin with. And
Absolutely.
that's pretty typical. I mean, there are
Mhm.
some people that are very eager to seek help, and we love those folks. They're, raring to go. But if someone's a little hesitant and they're already really sick before they do it because they've just been trying to manage it and thinking they can get through it, I mean, it can be difficult. This could lead to even maybe some of her resistance to some of the treatment suggestions that were
Mhm.
made, a little baked in personal stigma or stubbornness or whatever have you. It sounds like maybe her husband was a little resistant to meds, maybe not other
Mhm.
things, but maybe meds. So this could be very complex. Plus, she doesn't want to leave her kids. She's a mom. She's got a household
Yeah.
to do, and she's she's wanting to but she wants to get back to work and all this. So it's very complex, and these could all be barriers to someone seeking help in the first place. Never mind other barriers that are external.
It was really hard
Mm-hmm.
for me to get help. And I was well from a huge, very long manic episode into a really bad
Mm.
depressive episode. And it still took me a month of, after I had a lot of ideation one day, it still took a month before I could call the clinic and say, I need help. Like,
Mm-hmm.
and I had been through this several other times in my life. I didn't know that's what was happening.
Mm-hmm.
Instead, I had internalized that, well, I'm just not as good as everybody else. Like, I don't understand why this seems so easy for
Mm-hmm.
everyone else and why it's not for me. Like, I don't understand that, right? Why doesn't everybody else get,
Mm-hmm.
depressed and can't get out of their bed, and like, why? Like, that's a me thing. Well, yes, in a way it is a me thing, but there was something way more than about my willpower.
Mm-hmm.
Because it doesn't really matter how much willpower you have when you're in a crisis.
Did
Um,
you recognize when you were in your manic episode that
mm,
you were manic?
no,
Okay,
it
that's
was
pretty
coming.
typical.
It was coming
Mm-hmm.
out. I all of a sudden one day, boom, and I felt like I was free falling, and I knew where I was going, and I was set to get married like
Mm.
3 months later, and I knew how deep and dark I was going to go, and that it was going to be a long time. I had no diagnosis at this time, but I knew this. I could feel it. And I was like, we have to cancel the wedding. And I canceled it that week. And I was in that depressive episode for a good year and a half, with treatment and everything. So, but yeah, you don't really, when we get into like the psychosis part of, you can have certain things going on, but be functional. I think that's another thing that people don't quite understand. But also, for the crisis itself, I mean, it does take a lot to get you to do it. It's not necessarily because you don't want to. I mean, I couldn't even get out of my bed. I couldn't even use my voice. Like, it was so overwhelming and so bad. And it took that long before I felt well-ish enough to do that. But then also, I imagine in your field, most people usually come when they're already in a crisis.
Oh, yeah.
So you don't really know who they are outside of a crisis.
Yeah. And that's
they
the
might not
case.
either.
And that's the case with psychiatry is, yes, people are already having some sort of mental issues, or a disorder. They're having an issue. They are in crisis. They're at the point where they're seeking help. So yes, we don't have a good baseline of what this person looked like before they started having issues. And so it can be difficult. Now, we do have that baseline that day, but that's still not their, before their issues, before their crisis. We don't know what that looked like. So a lot of that, we have to ask. Some patients are really good historians. Some are not. Some we have to get that collateral information from friends and family and people who know them best. That's a lot of times that we have to kind of make a judgment call in the moment of whether we need to take that step or not. I love to, no matter what. Believe me, if someone's married, I love it when they bring their spouse with them that first visit, because then it's automatically we get that extra information, because people don't always have good insight as to how sick they are in the moment.
Not at all. Or how much of them is actually different. I mean, yeah, you're still yourself, but like you don't know, or you have a very hard time communicating what it is in that moment when you're trying to explain to a doctor, where maybe you've already talked about it with your person, and they can kind of, be like, oh, it was like this or whatnot. My partner, very involved with my care then and now, because you do need those other people around you. It's a team when you're dealing with a very serious illness and crisis. And so I think Lindsay and her husband, they were trying to do the right thing. But you do have somebody that's in the middle of crisis, and you don't really know where to go from there. You have a few options, but I mean, they didn't start anything really heavy with me. All the medications she's been on, I've been on. So before, I've tried all of them pretty much, I think, except for one. And I didn't think that they were, I know a lot of people were like, oh my gosh, these are so super serious, and they are. But I didn't, and again, I'm not the professional. I've just been on the other side.
Right.
I didn't think there was anything that weird about them. I'm like, yeah, that seems pretty normal to me. I don't know about any of you when I'm in a crisis.
I'm actually of the thought they were a little conservative with some of their choices, in my opinion. Of course, hindsight being 2020.
Yeah.
But, at some point, I would have been more aggressive and pivoted personally. But the thing about psychiatry is, like you said, it is a little bit of a crapshoot. I like to call it educated whack-a-mole a little bit. If we just try to minimize the number of moles we have to whack, rather than whacking the whole field. But I feel like, for the most part, the prescribing was appropriate, given Here's my issue with a lot of the criticism of the
Sure.
prescribing and everything is people are looking at it through the lens of this woman murdered her kids,
Yeah.
killed her kids. Yes, we know that now.
Mhm.
But when we are judging what the providers, their decision making and things, we need to take that out because
Mhm.
what happened is such a zebra in
Yeah.
terms of outcomes. I feel like it's important to understand that, certainly suicide can happen,
Mhm.
but typically we tend to think that's and given the information they knew at the time, that's what they thought now, don't get me wrong, suicide is terrible. We don't want that.
Yeah. Mhm.
But, you know, looking at those choices through the lens of, you know, this causing this, not that I think that caused it, but you know what I mean, is
Yeah.
I think we need to judge the decisions in the accurate context, the
Mhm.
information they were actually given. Were they making appropriate choices for the information? And in some cases, it's yes and no.
Mhm.
But certainly, different providers can have different approaches to the same issue in a patient.
Yes.
There's usually not a one size fits all. We do have guidelines and algorithms, suggestions on where to start and all that, but we're not beholden to the algorithms when it seems like a case doesn't fit into a nice little box. And I
Yeah.
would say in the case of Lindsay, she does not fit in any box in particular. Her diagnosis is very murky and it's still
Mhm.
murky. And I will see what happens when the defense actually puts their case together. If some of these questions that I have in my brain regarding her actual diagnosis are answered, I have a feeling we're still going to have questions, but
Probably.
but I think we need to understand that, we can't necessarily judge the treatment based on that outcome because they didn't know at the time. What we did know is she was suicidal.
Mhm.
Absolutely. She was suicidal, not sleeping. She was depressed. Here's the question. Did she have some sort of bipolarity or was it just MDD? I have
Mhm.
I have a feeling she might have some sort of not garden variety anxiety disorder in the mix there as well. It's hard to know.
Yeah.
Yeah.
Well, it's probably hard for her to know.
Yeah.
As somebody who's
Yeah.
been in that position before, you don't really know what to say or do, like,
Hmm.
at all about things. It's all very and your brain is not working.
Right.
People need to understand that when you're in a different form or episode, parts of your brain are not working normally,
Hmm.
like, at all. You can't even do something if you really wanted to, it's either going way too fast or it's way slowed down. Well, for people with bipolar disorder,
Hmm.
myself anyway. Um, but also, like, when you're in that, you are desperate for anything
Hmm.
to make it go away. And I think a lot of people who are watching this who have never had to experience it, uh, maybe they don't understand that there is not really a way to stop it.
Hmm.
There wouldn't have been just medicine and boom, she's fine the next day. Like, that's not at all how it works generally. Is that correct? Like, you're
Yeah.
not gonna be like, "Oh, here you go. Boom, you're done out of whatever, you know,
Right.
episode you're in." No,
Right.
it doesn't do that.
Yeah, and
Um,
and every treatment or medication can have varying lengths of how long it takes for them to quote unquote kick in or to see a
mhm.
benefit. And it also depends on how sensitive you are to the dose.
Yes.
Yes, yes, Belle, absolutely. And it also depends, like, let's talk about the Zoloft, the sertraline, the
Yeah.
first med that Dr. Tufts started her on. It's actually on, if we're going by the algorithm for postpartum depression, it is first line recommendation.
Mhm.
So I have no issue with the Zoloft prescribing there. Does not cause school shootings. Thank you very much, Mr. Reddington. Uh, um, So with the Zoloft, so it's an SSRI. I hate to say it, serotonergic medicines that boost serotonin are the tortoises of the mental health medications. Serotonergic meds tend to take the longest. And that is assuming she was going to respond to lower dosing of it.
Yeah.
So, we do kind of, usually they say anywhere from 4 to 8 weeks to see benefit. That can be excruciating in someone who is depressed or anxious, because we also prescribe them for anxiety. Certainly Zoloft is also a great medicine for obsessive compulsive disorder at very high dosing. So certainly if she did have something like that going on, postpartum OCD, she would have need very aggressive dosing on something like that to see benefit in that case. I don't know if she did or not. But
yeah,
it's going to take a long time. Now, certainly, typically, we give it about 2 weeks before bumping it up to 25 to 50. Perfectly reasonable. But I think it was a little more. There's nothing wrong with boosting it up sooner, like Dr. Tufts did. I think she did it sooner than 2 weeks. There's nothing wrong with that. But they can take forever. There are other meds that can work faster, but typically most medicines, unless we're talking about rescue meds for, say, your benzodiazepines for panic attacks and anxiety, stimulants for ADHD. Those are going to be rapid acting. You're going to feel them that day. But for most of our daily medicines, they're going to probably take at least 2 weeks.
Yeah.
Anywhere from 2 to 8 weeks if it's an SSRI or SNRI before you start seeing potentially beneficial improvement. And that's if it's the right med for you.
Oh, yes. I've had my fair share.
Yes.
Though I will say, I mean, I've taken some of the benzos she's been on when my anxiety was unbelievably bad, and they did work. But also depending what it is you're experiencing too, sometimes it's just not enough to make it go away.
Yeah.
And benzos are really, really dangerous. A lot of people know that. A lot of people don't know that.
Right.
Like that is one of it's very hard to get those. I mean, I'm not on them regularly. I was given them for a short period of time to get through what I needed to, but I also didn't want to be on them for a long time. But one of the things I was wondering with her, and I might have missed the testimony, so I don't know if you caught it. She's talking about being suicidal a lot, having a lot of ideations, which I don't know. I've been there.
Yeah.
It doesn't always mean there's one thing that's been talked about a lot that kind of does annoy me from the provider side. I understand why you guys have to say it, but it's well, she didn't say she had a plan. And I can tell you that it wasn't until one night of all the times I've been depressed in my life, of all the deepest, darkest places I've went, there's only one time where there was kind of a plan. And that I did hear a voice I've never heard ever in my life, telling me to take the pills. And I sat on my hands all night because I was so scared to move because I was at home alone. I knew I was terrified of it. And while somebody doesn't say they don't have a plan, that also doesn't mean that the plan can just come out of nowhere. It comes out of nowhere for a lot of people, really. So yes, maybe when and here's the other thing, being on my side here, is you also have to really trust whoever it is you're talking to be open with thoughts like that, because not everybody reacts the same way. And that can be really hard to say, yeah, I have these feelings, I have these thoughts, plan or no plan, because you're afraid they're gonna, lock you up or take away your kids, and that's not what happens usually. But that's just what you're thinking, in your head. So she was a little forthcoming, but I wondered why they didn't use something perhaps a little emergency, ketamine or something. That's become a big deal here. I've never personally had to go there yet, thank goodness. but it's on the list with
Mhm.
my medicine history. But do we know why that wasn't? Because I've seen really good results from that.
Right. Well, there's a couple things with ketamine, and certainly I've had some patients that have done very well with different types of ketamine treatment. So there's only one current version of ketamine that's FDA approved for depression, and that's the intranasal version of ketamine. It's called
Mhm.
Spravato, and you go to a clinic and get your treatment there because ketamine is a very high risk medicine. Um, you get your treatment there. They monitor you because it can cause spikes in blood pressure. You also have a little dissociation with it as
Mhm.
well. Usually, I will say there's a couple things. Number one, now certainly like intravenous or intramuscular ketamine do exist, but they're not FDA approved. So people usually have to pay out of pocket for those.
Yeah.
It can take a little time to get, here's where you gotta love insurance, right? So
Yeah.
usually insurance will not cover something like ketamine or ECT or TMS, some of the non-met, well, I guess ketamine is a medicine, but some of the more those new, not newer, ECT is not new, but these other interventions.
Yeah.
And they usually require at least 2 antidepressant failures during the current episode before they'll approve it. So I will say this, that was probably a barrier to them recommending. I'm not saying it's right. I'm not
Mhm.
saying it's right. Believe me, I'm of the thought that if I have someone come in and I think ketamine's the medicine for them and they've never been on antidepressant, I want them to
Mhm.
have the ketamine. So
Well, yeah, because
yeah,
your
but
goal is to keep them safe.
exactly, exactly.
Um,
But I think that was probably why. That's probably also why Dr. Tufts, she mentioned at the time it was called Zulresso. It's the postpartum depression medicine. That's no longer on the market. It's now Zurzuvae. But at the time, Zulresso it's considered an orphan drug actually, and it's a 63-hour infusion that you get in the hospital. It's a neurosteroid. And she did mention that in her testimony that they had talked about that. But again, it's an insurance thing. She would have had to have tried at least a couple of your standard antidepressants before insurance would have approved that. And I will say, just from my own experience of prescribing Zulresso several times for my postpartum depression patients, on average, it took 17 to 20 days for insurance to actually give it the go ahead.
oh
That's how
gosh, I thought you
long
were
the
gonna say
prior
to
auth
work.
takes.
I was like, "What? No,
No,
just to
no,
approve."
just to approve it.
That part all makes me very mad.
Yes, yes.
Because it really is when somebody's in a crisis, it is a ticking clock
Mhm.
because nobody knows how it's gonna go.
Right,
Not even the person experiencing it. Nobody knows.
right. Now, in
And
some cases, like if she had gone inpatient, depending on, I don't know what they had at their disposal when she was inpatient for the brief time, but sometimes those locations, if you're inpatient because you're in acute crisis, sometimes you can get kind of emergency use of like ECT, electroconvulsive therapy, which is actually on the algorithm for
mm,
postpartum depression, is ECT. And then sometimes it can be easier to get approval for that quickly if someone is inpatient. So
now
that might have been something they could have looked at had she spent significant amount of time inpatient.
yeah. I was gonna say here, in Ohio where I am, I don't know if it's just my city or the state, but I do know that like if you go to the emergency room in a crisis for suicide,
Mhm.
it's like ketamine right there. I
Really?
Yeah, that's
Mm.
my protocol should it ever need to happen. Because I don't have a lot of money, but that's what
Mhm.
I've been told to do by certain people I see
Okay.
to go there. But I don't know how that is in all states. So I don't know if that
Mhm.
was available even as an option in Mass.
Right.
It's only become a recent option here.
Mhm.
And I know some people that have used it then and also way back in like 2018 when it was trying to
Mhm.
get like human trials. And I will say this, because I used to run a facilitator for a NAMI peer support group. And a few of the people in our group used it, and it was amazing. It was amazing to see the difference in them, like, quickly, because it is about time. It is about trying to keep that person safe. And so I was okay. So that's why that wasn't on the table for her then.
Yeah, I think at the time, I think it was just a couple years ago, so it may not have happened. I think Spravato got an extra indication, not just for treatment-resistant depression, but for suicidal ideations. And so that might be why you're seeing it and I think that's wonderful, to be quite honest. I love to hear that.
Yeah.
So, yeah.
I mean, it's from what I've heard and from what I've seen, I have no personal experience, but it's on the list should I ever have to.
Sure.
But it's done a lot of wonders, I've heard, in the hospitals. So, but I guess that wasn't an option for them at that time, which is very sad. I mean, we don't know if anything would have provided a different outcome.
Right.
We don't know. But so if you are in crisis, please, there is numbers running across the bottom there. It's okay. It is going to be tough. It is tough. It's tough to be in. It's tough to try to get out of. But there is help there. And it breaks my heart because, one, what happened, the murders aside, which are just so unbelievably tragic. Really, to me, this entire case is just tragedy all around.
Yeah.
From what I've been observing, it's a tragedy for the children, a tragedy for the family, for even Lindsay to have. This is my opinion of the trial, that if this was what happened, to have to live and deal with that. As somebody who's went through manic episodes and then afterwards have had to pay the prices for decisions that I would have never have made any other day. Unfortunately, that is part of the negative part. But when you add an insurance and people not talking to one another, can we talk about that next?
Let's talk about that, because that's my biggest problem with the care she received. She got a lot of care. It was just all splintered. So she had a lot of people caring for her, a lot of, but it was not integrated. It was not collaborative. I think a lot of times it can be very difficult coordinating care with providers outside where I work. I'm lucky in that I work in an integrated care model. We have therapists, we have medication management, we have some other interventions that are in clinics. So it's easier for us to talk to each other. Someone can see me for medicine, see one of the therapists for therapy. We're talking, we're doing all this. Yeah, it's wonderful. It should always be like that. That's the ideal. My issue was, and poor Dr. Tufts, I feel bad for her, but she made a mistake. Actually, several of these people made a mistake. And that's the minute she started getting prescriptions from someone else. I prescribe all of your psych meds, or I prescribe none of your psych meds, because it is not. Otherwise, you're playing a tug of war. I mean, it's already educated whack-a-mole. Why add more to it?
And some of them are pretty serious drugs.
Right.
Like, that can have some really not good side effects.
Right. Now, certainly, a lot of this was Lindsay was seeking the care from these people. She was obviously very desperate to feel better. And so desperation can lead us to make poor choices for ourselves. She would have been better off sticking with one person longer, or, not just going to all these people but again, she was desperate. But certainly, I think these providers, once they knew she was seeing other people and technically you don't need a release of information to satisfy HIPAA, because if you've got this person seeking care, she is seeking care, that is assumed consent. This is an exception to HIPAA protections.
Okay.
So, there is nothing saying, well, I can't talk to this person because she hasn't signed a release. Legally, you don't need that.
Because she's come to you is what you're saying.
Correct. Legally, you don't need that. Doesn't keep people from trying to sue people for that, but legally, that's an exception to HIPAA. So there was nothing legally keeping these providers from talking to each other. I will say this, though. It is very difficult in a lot of my days to find time to actually call another provider. Let's say I have a patient who is seeing a therapist, not in my clinic, seeing a therapist in another clinic. It happens.
Okay.
And we need to talk about it. It could be very difficult to coordinate care within the workday. Oftentimes I have to go after work, unpaid time. It sounds bad, but
I know mine. It's like I get a 5 to 15 minute call with my NP. I was getting an hour of therapy a week. That's probably going to go down now since I lost mine to like a half hour every 2 weeks. Because there's so many people trying to get care and help that I know you guys are very like
Right.
your schedules are infuriating.
Right.
I get it's not a lot of your choices,
Right.
because that's just how those situations work.
Right.
But it's jam-packed every
Yeah,
day.
and it's not an excuse for what happened with Lindsay. It's more of an
Sure.
explanation than anything. It doesn't make it right. I feel like if someone presents to me like Lindsay did, postpartum, and certainly very troubled, chronically suicidal every time I'm seeing her. This is someone I want to talk to other caregivers, but at the same time, I'm like, I'm not going to be sharing inpatient's different. If she gets med changes inpatient, that's different. And then she's discharged, then I have to take it over. But in general, it shouldn't be different outpatient med management people, prescribing their own stuff. I get frustrated enough when people's primary care start messing with the psych meds.
Girl, let me tell you what. Every person, like when somebody I know comes to me, right, and they're like, "Well, I'm gonna go to my, general practice doc." I'm like, "Whoa, no, please do not do that." And that is no shade at them as doctor. They don't really specialize in that field, which is they have some base knowledge of all the different things.
Yes.
Right?
Yes.
But some people I know that is their only help, right? If you live in a rural place, that might be the only place you can go. And I completely understand that. Not great. But every single person I've ever had come to me, I've been like, no, please go see somebody who's special. You wouldn't go to your general doctor for, brain surgery, would you? No. What are you doing? No.
Yeah.
Please try. But it is hard also to get quick appointments with people. It's then you have insurance, all of the above. But yes, please don't go. It's not a choice.
Yeah, I mean, and a lot of them only know what they learned in medical school, because mental health is usually not their priority when it comes to their continuing education. It's pressure, it's diabetes, it's the stuff that they see most often, even though they probably see more mental health than they think. But it's not their bread and butter. And certainly I feel like having an integrated care model or a better coordination of care and all that, we don't know, could have been the same outcome. Hard to know, because also, to be honest, in my experience, for people who have decided to unalive themselves, they're going to find a way to do it.
Yeah.
And that probably is the same for if they want to unalive other people. And because a lot of times I know the patients who have completed of mine, I had no idea. They had denied. They had, or the ones that, they were struggling and they didn't let me know. And then it's very difficult. And so it
I mean,
may
most of
not
the
have
time you
been.
aren't going to know.
Yeah.
That's one thing that people have been saying about Lindsay. Well, she was off doing this, this, and this. Yeah, and
Mm-hmm.
there are many of people who would still be with us
Yeah.
who were also having good days where they were going around and living life and talking until they weren't.
Mm-hmm.
It's more common than people want, I think, to
Yeah.
believe. But I just real quick before
Mm-hmm.
you continue back up, Amos over here said, but you should go to your GP, then not go
Yes.
see anyone.
100%. Yes.
Absolutely. I agree too.
I will say this, though. If you have a psychiatric prescriber, though, if you are already established with somebody, please don't let your GP mess with your psych meds. If they have a concern, you can relay that to your psych provider and then they can make the decision. But it's important.
I got pregnant about 2 years ago,
Mm-hmm.
and I was 39. So it was, but anyway, we had to have that conversation
Mm-hmm.
with my NP and my OBGYN. Like, what do I stay on? What do I don't stay on? And it was a lot of back and I mean, it was up to me to decide whatever I wanted to do, of course. But they were both very interested in communicating with each other
Yes.
about my care, because there could have been really, serious consequences for things. I did lose the baby, so we didn't get that far into it. But that is one of those examples of I chose to go off all of my meds at the time. But I had very good conversations with both of my doctors about it. And I think that that was really important.
Yes.
um,
Yes.
for that, because I had people around me watching me and, all of that. But having your
Right.
doctors be able to communicate about serious stuff, because it all affects everything.
Yes. Yeah.
Um,
I mean, it really does. And so that's the biggest glaring thing that I've seen as far as Lindsay's providers is just that lack of communication. And there's no doubt that was a problem and it's not ideal and it needs to be better. Thank you, Amos. Thank you. It needs to be better. I don't know if it would have changed the outcome for Lindsay, but it wouldn't have hurt. That's for sure. My thought is at least try. So when I did hear some of them not even try to communicate, I'm like, come on, guys. Come on.
yeah. And some of them left a bit to be desired.
Yeah.
And I understand too that there is a lot of burnout in the field. It's a thankless job. All right. I know that from my own personal experience. When something's not working, you blame them, even though like sometimes it is them, but sometimes it's just the nature of the beast that's going on with you. But it's some of the things I was just like, oh.
Yeah.
Do you think maybe you should be doing this? I don't know. I'm sorry.
Yeah.
Yeah.
And I know that Dr. Tufts kind of got reamed for the only seeing her on telehealth, and I'm of two minds of it. I think if that's all you got, then it's great. I prefer if someone is local to me, if it's at least the intake appointment, that first appointment, I want to see you in person.
Yeah.
And certainly if someone for me and this is a lot of just the way I want to do it is, and if there's an exacerbation, if there's, something going on, or if, man, am I missing something? Or yeah, let's do the next one in person. Let's, and bring your husband or bring your sister or bring, or whoever is good collateral information. If I feel like something's missing, like what am I missing here? Like when trying to determine, do we have some sort of bipolar disorder?
Mhm.
I mean, I think she didn't quite meet the criteria from just the appointment questioning Lindsay. But again, for people who are having, they can have poor insight. And so you might want, now that's fine if Patrick says, yeah, I didn't see this and this and this and or any of that. And
Can we
okay,
clear up one thing real quick since you
sure.
brought up bipolar disorder? And that is that bipolar disorder, by the way, because people get this wrong all the time and
Yeah.
it really annoys me,
Sure.
is you get episodes of things. Otherwise, when you're not sick, you're fine. You're
Right.
you're functional with everything. You're good to go. But also, not every episode has to be a manic episode and a depressive episode. Um, from my understanding, is
Yes.
that correct? Because
Yes.
some people were like, well, she didn't see manic, and I'm like, okay, but like that's not
So
entirely how that works.
for
Sometimes,
for bipolar 1 disorder, so there's we have it's not all cut and dry. We have bipolar 1 and bipolar 2, and then we have sub flavors of the
yes.
two as well. So bipolar 1 is at least one full manic episode and at least one full depressive episode.
Mhm.
Now, there are symptoms that fall under mania and depression on that, but you only need one of each to qualify for that diagnosis. In the case of bipolar 2 disorder, it's at least one hypomanic episode, which is just like diet mania, and at least one depressive episode. And then there's also something called cyclothymia, which is what people think all bipolar is, which is where you have at least 4 mood episodes in a year. And then
Yeah.
there's all these other flavors. So you really, for a bipolar 1 diagnosis, which I think is what the defense is, where they're going, like a bipolar 1 with psychotic features or something, is where they seem to be heading. She only needs one mood episode meeting the criteria for mania. And obviously she's had a depressive episode,
Right.
obviously. So the question will be, number one, has she had an actual manic episode that meets criteria? So that's one question that I will look forward to listening for in the defense. And also, what are these psychotic features? Obviously, the auditory hallucinations is what she said, but there is some question. Have you read the civil the filings for the civil report?
No, I lost
Yeah.
power for several days.
Oh my
And I was
gosh.
like, damn it. And so I haven't yet, but it is on my reading list
Okay.
for this
Okay.
week.
So
I might do a stream of all
yeah.
this.
So it'll be curious to see. It seems like Patrick's filings are consistent with his testimony. So all the conspiracy theorists on Patrick can cool your jets.
They won't.
No. Lindsay's there's a few so far. I mean, we'll see what else happens with the defense, because this thing's not even halfway over. There are some differences between the civil filing and what has come up so far in this trial. So it'll be curious. Now, bear in mind, she was depressed. We know she was depressed. That we know. She was depressed. That is one thing we can all agree on. She was depressed. And sometimes people's memories aren't the best when they're in crisis.
No, not at all. I've tried to explain to people kind of how, whether you're manic or you're depressed, and how you take in information. It's not how you normally take in information. So it's not that you don't necessarily like remember because you were blacked out the whole time, but you may actually just not remember because it just didn't register where it was supposed to.
Well, and everything that you're taking in, all the info, all the things you do, especially when you're in a very severe depressive episode as she was, is tainted by that depression. There's this saying that depression lies. Depression does it forces you to have these cognitive distortions that make you think very negative things. And certainly, she talked about those intrusive thoughts that were very negative about her not wanting to be here, and they were probably very and stuff like that. And that can certainly also color your memories of things.
Would you
Yeah.
consider that delusions?
No.
Would those be considered? No?
No.
Okay. I just wondered how they were a little bit different. If you're still like,
it's a
it's
good
not
question.
real, it's not true.
It's a good question. So the main difference is the delusions, the cognitive distortions. There are these saying, you might have heard of them. There's ego dystonic and ego syntonic.
Okay.
And what this means, ego dystonic, anything that's, dysphoria, dys means the bad. Ego dystonic means I don't like this. I don't feel good about this.
Okay.
I have a problem with this. Ego syntonic is kind of like, it's okay. It's working for me. It doesn't necessarily cause distress. So if you think of dystonic, distress, cognitive distortions tend to cause, they tend to be ego dystonic. People have them, they recognize them, they realize that I know I'm too negative on myself. I know I'm too hard on myself. I know this stuff isn't true. I just can't help thinking this.
Okay.
Whereas a delusion is something that's as real as you and I sitting here talking. The delusion seems perfect. It makes perfect sense to me. And because it makes perfect sense, it doesn't distress me as much. It may distress people around me if they're aware that I have them, but they don't, there's that lack of insight. So the difference is like that insight. Does that make sense?
Well, I guess the reason I ask is, so let's say hypothetically here, right? So she's having these ideations, right? That she shouldn't be here anymore, right? And it's starting to make a lot of sense to her. Obviously, we know that that is not reality. Despite what your brain is telling you, it is only temporary. It will go away. Don't listen to it. But not everyone can do that in times like that. But then, so she has these thoughts. It's starting to make a lot of sense to her that maybe this world would be better without me. Or maybe my kids, maybe it would be better for them to not be here so they don't have what I have. So that's not delusional in a way. No?
It can be. It can kind of evolve into that.
Okay.
This is the problem with psychiatry is it's not black and white at all. Even though we have this DSM that gives us this nice criteria, sometimes it's not easy because people don't fit into these nice little symptom boxes.
No, we're so messy.
Yes. And so it could be quite difficult. But usually, though, like I said, in the example you gave, the person's probably still ego dystonic about it.
Okay. They're still in distress about what's happening and all of that. Okay. Thank you for clarifying that.
Yes. But it can, like I said, I hate, my favorite word when it comes to psychiatry is murky. It can be murky. But also can be murky is a patient's description of it. I have had patients, for example, describe tics as seizures. And so when they say, yeah, I have these seizures, and I'm like, oh, you have a seizure, and you have to kind of dig deeper to get their clarification. So there's some question. I've seen some debate, is these intrusive thoughts that Lindsay was describing for months, were they actually anxious intrusive thoughts or negative intrusive thoughts, or were they actually hallucinations, auditory hallucinations, or the psychosis? She just didn't know how to describe them. That's a question.
Very well be the case.
Yeah.
I just from personal experience, like it's very hard to, when I was getting my diagnosis, my first time meeting the psychiatrist about things, they had more questions after my intake exam. And there were a few things he asked that I didn't know other people didn't experience on a regular basis. I didn't even know that only happened during certain times. Like I didn't know pseudo hallucinations were a thing. I thought Oh yeah, people see stuff out of the corner of their eyes all of the time. And when the doctor and my partner, they both just kind of looked at me like, what the? And I was like, oh, you mean other people don't? You
That
know,
was your reality. So you're like,
yeah.
well, it's happening to me. So obviously,
How
what's
would
the
I know?
problem? Yeah.
You know, so sometimes you don't even know
Yeah.
what to communicate because you don't know what that means. Like,
Hmm.
you know, when he asked me, have you ever had hallucinations? I was like, no, but I do scare easily because I always think I'm seeing stuff out of the corner of my eye and then it's not
Hmm.
there. And he's like, yeah, so about that.
Right. Right.
But you just sometimes some things you don't know. And now I
Hmm.
know that's one of my, you know, alarms like, uh-oh, we're seeing some of this. We
Right.
better, you know, start
Hmm.
doing what all we need to
Right.
do to take care of ourselves and
Hmm.
all of that. But sure. And
Yeah.
if you've never been in a crisis episode, right? If she's never really experienced it several times in her past life, how would she
Yeah.
even know? I
Right.
mean, I don't know how one would
Hmm.
know that.
But that's very difficult also because, even if you're trying to get the patient to clarify, they still may not truly be able to describe what they're experiencing. And that's kind of difficult. It's kind of, I wanted to talk about at some point here the actual law itself, that we're talking about,
Yeah,
because I find
absolutely.
it interesting and also ridiculous the way
Yes.
Massachusetts has their law. Because if someone is having, now usually like delusions, delusions are probably the easiest form of psychosis for a clinician to pick up on, because at some point the delusions, because the patient thinks there's nothing wrong with them, that I'm using logic, it just comes up. It just
Right.
comes up. They start talking about, the Martians in their backyard or something. And you're like, oh, okay.
Hmm.
Paranoia can be a little trickier. It depends on the level of paranoia and what they're paranoid about. Hallucinations are difficult because a lot of people think, obviously there's the folks who actually will carry on a conversation
Hmm.
with whatever they're visualizing or hearing out in the middle, out in the open. There are people that do that, and that one's a little easier to pick out. Oh yes, they're having hallucinations.
Hmm.
And but there are people, when it comes to hallucinations, it's really it's like a he said she said type thing.
Yeah.
And certainly if they say they are, we believe them. In that case, okay, well, let's get you on an antipsychotic or something like that.
Hmm.
Obviously, it never got to the point prior to the murders that, I mean, she was on Seroquel, but to a degree, well, they prescribed Seroquel.
It seems just to be for her to sleep based on, at
Yeah,
least that's what they dosage they gave me was just
yeah,
to sleep. It was not for therapeutic
yeah,
reasons at
yeah.
all. But
And it is used for sleep off label, and it can
mhm,
really knock people out, and
mhm.
especially if they have anxiety,
Yeah,
it
that's
could be great,
exactly.
great for anxiety.
Mhm.
Um, yeah, but it's also an antipsychotic. So you'd think it could knock down. I mean, it was like 300 milligrams. That's not insignificant if she was taking it. I
Oh,
think,
by the end towards the date, right?
yeah,
Because
yeah,
at first it was very small, and I
yes,
was like, "Oh, that was probably for
yeah,
sleep," because that's like what
yeah.
I was on for
Yeah, I would
really bad
think
stuff.
it would knock back if she had been taking it. We don't know, because she reported she took a bunch of the pills right before she
Mm.
attempted. And so we don't know, was she taking it, or was that the stuff she took right before then? We don't know. Um, but if she had been taking it, ideally, you'd hope it would have knocked down some of the hallucinations, but it's not perfect. Sometimes it's not the right med for someone who's having psychosis.
Mhm.
Um, but it's very, man, it's just unfortunate. But it's difficult because the hallucinations are difficult because we really rely on the patient for that, because even people around them can't tell us what someone else is experiencing in their own mind
Right.
unless someone is telling that person.
Exactly. Especially with like a field that is all about self-reporting.
Right.
Like,
Right.
other parts of your body, you can run machines and it can give you answers. But unfortunately, this is not one of those things.
No. And I think, that's why there's a lot of misunderstandings regarding that. I mean, I think we saw some of it in Reddington's cross-examination of Dr. Tufts in in some of the things he was saying about Zoloft, which, most of the time is perfectly safe. Certainly people can have side effects and it's not the right med for everybody. But there was nothing wrong with that choice in the moment.
Got mine right here.
Yeah. It's great. I'll prescribe a ton of it.
Well, that I started taking that. I didn't find that one for a very long time, which was when I got it. I was like, oh, this is great. But that was one of the ones after we lost the baby and we're considering trying. I wanted to be on something because obviously it was a very tough time.
Right.
But also, something in the meantime that isn't going to be hard if I get pregnant, blah, blah, blah.
Right.
And that's the one that my NP was like, actually, there's been testing done on this. And of all of the ones, this one's probably the safest one you can be on, in the meantime. So
yeah. So that was my worry with that. I mean, I was seething by, that, because I'm like, oh man, this is, making it sound like fed her rat poison or something. It's like she wasn't doing it. Now we could discuss, did it cause some mania when she increased to 50?
That's one thing my friends and I have been talking about, because go ahead and explain why that's a problem.
So,
if somebody has bipolar disorder.
Yes, if someone has bipolar disorder, so you don't want them to have an SSRI or an SNRI, which are two, your garden variety, what people think of as antidepressants. They need to not be on board with no mood stabilization. Certainly people with bipolar can be on an SSRI or SNRI, but you need to have some sort of mood stabilizer on board. So we usually give them for anxiety in those folks. But in rare cases, and this is rarer than people think, but it does happen, is people who maybe had bipolar disorder, you had no idea, can have mania or hypomania triggered by prescribing an SSRI or SNRI as basically monotherapy alone as far as an antidepressant. It doesn't. So that can happen.
Well, and most people don't go to the doctor when they're in a manic episode.
Right.
It's after it's over. And then you're depressed. And then you don't know. You're like, are you just regularly depressed?
Right.
Are you don't, as a provider, you don't know.
Exactly. I mean, there's some signs. There's some hints that someone could have a hidden bipolarity. It's kind of complicated. Family history, if they have a family history of bipolar disorder, certainly that makes them higher risk for having that. It's not a slam dunk. And certainly,
but if they even tell you,
sometimes people don't even know because people don't talk about it. Certainly it is true that postpartum depression, people who have postpartum mental health issues, our radar should be up that they have a hidden bipolarity. This is true. Age, it would depend on age too. Now, I think Lindsay was 32. That would be a little older than what you would typically see, but it's not impossible. I've seen people have their first manic episode in their 50s. Again, there's an exception for every rule.
Right. And you only need the one.
You only need the one.
Only need the one.
Sometimes people at their first manic episode, they may have had a hypomanic episode at some time in the past, but it was missed because people tend to like the hypomania. because, oh, I'm getting stuff done. It's not as problematic because this energy, you're getting stuff done. Maybe you don't get in as much trouble. Maybe it presents as cleaning and not gambling, or, you know, you don't get in much trouble. And so people tend to not really look at it as a problem. And then maybe later on they have their first manic episode, but people tend to have a significant amount of depression before they ever have a manic episode, usually. And that's why it can take 8 to 10 years for someone with bipolar disorder to get diagnosed after their first depressive episode.
Oh, yeah, absolutely. I mean, yeah, I was 32, 33, but I had been experiencing it for a very long time. Because once I was like, oh my gosh, this makes sense. I put together graphs and as far back as like I could remember, because there were just these small periods of my life where they were like the extreme versions of me. Like I'm a very frugal person. Not always. Let me tell you what. I'm pretty, reserved and quiet and introverted.
Right.
Not during those periods. Let me tell you what. I was like, oh yeah, this makes a whole lot of sense.
Right.
But I would have never have thought honestly about the manic episodes, as though I thought I was just not a good person. Like I thought I wasn't as good as other people. Like I just have these problems that it just happens randomly. And now it's been several years since my diagnosis and I've been very well. And I'm like, oh, okay. Yeah, no, that's not why that was happening then. Okay. All right. That makes sense.
Well, I'm happy to hear that you've been a lot better since you've gotten treatment.
Well, it's still a tough road. I mean, manic episode wise, I haven't had one since 2018, but depression is a whole different.
That is the tough one. That is the tough one. Mania is easy. Depression is not.
Well, cleaning up the mess afterwards, not a good time.
In terms of treatment, mania tends to be easier to cool down than to lift the depression up.
You got to go on an apology tour. Right. You got to spend years cleaning up whatever disasters you left behind the last couple months. But no, treatment was very important. It was not an easy process. It was a lot of trying many of the drugs Lindsay was on. And I remember the very first one I tried after I got diagnosed was Latuda. Well, it did not work for me. And I hated it. I hated how it made me feel. I felt like my brain wasn't working at all. And I was quickly taken off of that and we started a different way. But I do know like during that time period, I was desperate for an instant fix, to it. And that was really frustrating both for me and my partner who's my caretaker, right? He has to really watch me go through all of this. And it's awful. It's awful for him to have to see. But those first 3 months, it's a lot.
Yeah.
It's a lot going on in your mind. I understand why she may have been hesitant about taking the drugs. I've never taken any except for 2 that I had a really bad side effect with. And that's just how we don't know until we know.
Right.
I don't think that was
right.
Many people do those drugs or prescribe them, not do them. That's not the right word. Many people are prescribed them, but just each person handles it differently. But it's really, it's a lot.
It is a lot. And, she had this activation after the Zoloft was increased to 50. And certainly, so was it inducing a mania or a hypomania, or was it a not uncommon SSRI activation that is not bipolar? Because both can happen, certainly. So what is the difference between a hypomania and a mania and an SSRI activation? How do we tell the difference typically is once the offending drug is removed, and yes, at the 50, she was fine just having her stop it. It was fine. It would have been fine.
Oh, you mean like her just instantly stopping?
Yes.
This,
she hadn't taken it for very long and it was a low dose. People can stop pearl clutching on that.
Yeah.
I'd worry more if it was 200 milligrams. That would have been a no. But the SSRI activation tends to go away when the offending drug is removed. Whereas if it's mania, it would tend to persist past that point. So when I was actually looking at the testimony, Lindsay was basically reporting that she was at least the pre-Zoloft Lindsay.
Okay.
In less than a week after the Zoloft was stopped. So, and that would indicate to me, there's no absolutes, but it was less likely mania or a hypomania and more, the needle going towards just an SSRI activation.
Okay.
And so again, trying to not use the hindsight that of what happened, I think it was reasonable for Dr. Tufts to try the Prozac since she did report no issues with it previously back in college.
Oh, so she was okay.
Yes.
I didn't know that.
Yes.
I must have missed that information. That's
she
interesting.
had reported taking Wellbutrin and Prozac back in college.
That's interesting.
So I think it was reasonable, and probably she was thinking it was either just, well, it's just a side effect or it's just the activation. We'll try this Prozac. She tolerated it before.
Well, and that's just a normal thing that prescribers ask. Like they ask what's worked for you in the past, or most importantly, what's worked for your family members, if any of them take it.
Right.
I've been asked that numerous times.
Yep.
That's pretty normal.
Yep. When in doubt, did someone in the family with similar symptoms do well on a specific medicine? That's not a bad place to start. For sure.
Oh, it was from this week. See, I haven't been able to watch anything this past week. And no power for like 3 days. So, okay.
So, but you could see how tricky it is. And so these providers that are trying to figure out what's going on with Lindsay, and certainly Lindsay, I will say this right now, fellow healthcare providers can make for the worst patients because we want what we want. We know we know too much, so I'm sure my GP, I probably annoy the heck out of her. So, certainly it's hard to know, was Lindsay overthinking everything? Was she over anxious and not giving things a try? People can certainly make themselves so anxious that they think they're having side effects when they're not. I don't know if that's the case with her, but I've seen it. And so they kind of think themselves out of giving a medicine a chance.
Oh, anxiety is
anxiety
is the worst.
Yeah. And there's no doubt her anxiety was sky high as well. And she wasn't sleeping well.
Which is very important.
Yeah.
Because there was, at the beginning, they were talking about how she seemed very regimented, like with sleep and eating and things like that. And I'll just say, like, when I first started, getting diagnosed and helped, those are all very important things that they talk to you about because they can be more triggering or unhealthy. It's not that it's going to fix what's going on with you, but the more sleep you can get, the better.
Right.
So I don't know if that's why she was doing that or if it was for a different reason, but I charted every day how I'd feel morning, afternoon, night. Like I was so just because you're desperate to try to figure it out. I can't talk about the despair anymore, or any more than I am, because it is so profound to just make it stop.
Yeah. And she, you could tell she was just desperate. She was flailing, and it probably did stand in her way. Because that's also probably why she tried so many providers, because she was just, maybe this one has the answer. Maybe this one has the answer. And I get it, but that's also not helpful either. I mean, second opinions, third opinions, fourth opinions, I mean, they're fine to a degree, but it's man, this is such a perfect storm of crap. I'm sorry.
Yeah, it is. No,
Yeah.
that's what's so tragic is there is
Mhm.
not, I know everybody wants to blame everybody in this,
Mhm.
but unfortunately, it's a
Mhm.
series of very unfortunate
Yeah.
circumstances that led to
Mhm.
absolute
Yeah.
devastation.
So,
And
Belle, good point. So I
same,
hear this all the time
same.
from mothers of young kids. They
Yes.
don't want a sleep aid because they want to be able to wake up if the kids need something. And
That
so
or take him to school.
yes.
That was my
Yes.
thing.
Yeah. Very common. I
And
mean,
for me, Seroquel, like I felt like a little hungover in the
mhm.
morning from it. Like I was not hungover, that's not the right one, but like I was slower, like getting up and
Yeah.
moving and kind of it would take a few hours before I was like with it.
Mhm.
It helped with sleep, but
Yeah.
that's when mine was in elementary school and I couldn't really take it during the week
Mhm.
or it was it was not great.
Yeah. I
But that
mean,
was a
we're
real thing for me. So
yeah, absolutely. And it's a real concern. And I hear it and I
mhm.
see, parents of young kids that are really suffering with their sleep because they feel like they're not safe to take something,
Mhm.
but so they just kind of white knuckle it and that's not great, that I mean there are some more mild sleep medicines out there.
Yeah, that's what
um
I ended up
yeah.
a after that for some time. It did great for sleep. It
Mhm.
did put you to sleep,
Mhm.
um, but I could have seen that being a issue of
Yeah.
concern.
Yeah, absolutely. That might have been part of it. So,
But that we don't know if she communicated that to them
right.
or not, right?
Mhm.
Um, so I don't know. But let's talk about the law
Okay.
because this one is
It's
I hate it.
backward.
It's
It's backward.
I get it because I always find reason of insanity. First of all, I think it's really important. Because I do feel like there's a very distinct difference in why some people do what they do.
Mhm.
So that's great. But also, it doesn't allow in the many gray, complex areas we've just talked about for the
Mhm.
last hour and 30 minutes. But you go ahead with that.
S- so so the state or the Commonwealth, excuse me, it's a Commonwealth. The Commonwealth of Massachusetts has to basically prove the onus is on the Commonwealth, which is what is unusual here. Because most other states, the burden of proof is on the defendant to
For an
prove.
insanity defense,
Right,
yeah.
right.
Oh, it's not, it's on the state? I didn't even know that.
Yes,
Okay, I gotta let my
Massachusetts,
dog
it's
out.
on the state. So,
That's interesting.
so they have to prove that Lindsay knew right from wrong when she was killing her kids and that she lacked the capacity to resist basically the psychosis. So those
Okay.
two things. And that's what the state has to prove, which seems to me, how do you prove a negative?
Yeah, like what? All right, sorry.
So I
Let
kind
the
of
dog out.
liken this to the example of, when an atheist and a believer are debating and the believer goes, well, you prove to me that God doesn't exist. Well,
Yeah.
it just seems like, how can they do that? Because a lot of times, especially with hallucinations, it is what the patient reports. There's no proof. It seems to me
Mhm.
the only proof that the state would be able to come up with is something like she wrote down that she's faking this, or she wants
That
to kill the kids, or da 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 da. It just seems to me like the Commonwealth is set up to fail.
yeah. How does one resist psychosis?
Well,
Please let us know, because then you've solved
resist the
psychosis.
command. Resist the command.
Yeah,
That
which
sort
I
of thing.
suppose that's what I did the one time I've heard
Yeah.
a command, but
Yeah.
that doesn't make that doesn't make
Right.
my choice better than others who
Right.
couldn't resist. Like I don't
Yeah.
think that's fair.
I just don't
Um,
understand how the prosecution, and don't get me wrong, I don't think the prosecution is doing a good job anyway, but they're kind of set up to fail with how this law is, I think, because in the case of an auditory hallucination, I don't know how the Commonwealth could prove that either A, she didn't have any, like the command hallucination is not, she's lying about that either, or that, I just don't know how they would prove maybe the right and wrong, but how could they prove that she was capable of resisting the command? How do you do that?
How do you do that? But also the right and wrong. If during that time she thought that it was the right thing to, yes, we all know killing your children is bad. But if you're not in your right frame of mind, where your mind is telling you, hey, I'm not specifically talking to Lindsay, this is a hypothetical, that this is what's in the best interest of the children. In that time, when you do that, it doesn't feel like it's the wrong thing to do because of the reasons behind it, which many people do all the time. I'm not saying it's justified.
A common delusion in postpartum psychosis is the delusion that your kids are possessed or evil or something like that. That actually is a common delusion in postpartum psychosis. Obviously, I don't think Lindsay's claiming that. She's not every case, potentially. But in that case, you could see where a mom is trying to save the kids from some sort of fate, like they're possessed or they're evil. So in that person's mind, it makes perfect logical sense. It's the right thing to do. So, I think they're setting it up because I think what one of the one thing she has reported the voice told her that I read is she couldn't unalive herself if the kids were still alive. Like, I can't do this because they're still here. I can't do this to them.
Yeah.
So I need to kill them so that I am then free to kill myself with a clear conscience, technically. Because I'm like, but here's the thing. If that is what they're going, and we'll see if that's actually what they go with. But if that's what they go with, that tells me that she knows right from wrong, that she knows it's the wrong thing to do, but she feels like she has to do it.
Fair, but you did say the law says resist.
Right.
So that's the tricky word
It's
there
tricky.
in that scenario.
It is tricky.
But I don't know. Even then, I think I could argue that while she generally knows it's right and wrong, still a right in her mind there, and that's what we're arguing about, I guess, right? Is whether or not at that time she's like, yes, this is the right, just thing to do, even though it's horrible. But also some of the things I've seen other people say is, oh, well, she didn't hear the voices all the time. Like I said, based on my experience, I hadn't either until I did. It lasted for several hours, and then I didn't hear it ever again. And people in my support group who have been there as well, some of them, not all of them, but some have reported hearing something like that as well.
I think in her malpractice filing, she actually mentioned hearing the voices almost constantly starting in December. And she's going back and saying the intrusive thoughts were actually auditory hallucinations. This is retroactively saying this. Now, certainly she has hindsight, and certainly she may have misinterpreted what was going on in her brain as intrusive, because certainly a hallucination would be an intrusive thought.
Yeah, but they're two very different things for people that's never experienced them.
Right.
Two very, very different things.
And she is a nurse.
You may not know that.
She is a nurse. So I would think she might have a better idea than a layperson of what's an intrusive thought and what's a hallucination.
Wasn't
I
she a
maybe not.
maternity nurse?
Yeah, but she still had a psychiatric class in, I don't know. She may not have. But yes, so an intrusive thought and a hallucination. Again, the difference a lot of times, number one, intrusive thoughts are ego dystonic. Usually, not always, but hallucinations, psychoses, or hallucinations tend to be egos, or people aren't as distressed by them usually. Also, people will describe hallucinations as emanating from outside of them. This voice is not me. It's someone else. It's someone over there. Whereas an intrusive thought, it's a little more, this is me thinking it. This is just my negative self-talk, stuff like that. So those are some big differences between the two.
No, I'll say when I heard that, it felt more in my brain than outside of me, but it's such a weird experience. It was so weird. Thank God I haven't experienced that again, but it's still scary. Even intrusive thoughts they're tough. They're tough. But she very well could have not known the difference.
Right. I mean, it's possible. It's possible. I'm making an assumption thinking that she would. It's possible she didn't.
Yeah. Well, what do you think then? So the defense is going to be putting on a defense, right?
Yes.
I assume so. Even though it's not their burden, which is very interesting.
And I assume she will not. There's really no reason for her to testify because the burden's not on her.
No, not at all. I wouldn't. If they got to prove what was going on in your head, the only way they can do that was with your own words. So quite frankly, don't go on that stand.
Yeah.
But I don't know. I feel like that I get it. I get there's a lot of, we want justice for what happened to those little babies.
Yeah.
And I hope people understand that just because we're having, like, what happened to those kids is not, it's not that it doesn't matter. It absolutely matters. But for me, why this is so important to talk about is because Lindsay Clancy, if this is what she experienced, she's not going to be the last one. There's going to be women everywhere who go through this. There are going to still be people who lose their lives. There will be kids that lose their lives. If we can't have a real serious grown-up conversation about all of this, I don't know this to be true, but I feel like where the online conspiracies have come from and all of this is because it is a terrifying thought. One I had to come to the conclusion of that your brain can turn against you at any time, at any time, and to anyone. Some of us are born with something that it persists all of the time or more often than the others, but it can happen to anybody for any reason. And that's terrifying to where, I don't know, maybe for them, it makes more sense if it was just the husband who did this crazy conspiracy thing than what the real truth is. And that's that, I feel like a lot of the internet too wants to glamorize mental illness. It's not. Somebody that has it. No, I'd rather not. Please and thank you. I'm not ashamed of it. I'm very, outspoken about it. I like to bring awareness to it. I'm very knowledgeable about my conditions. But I would give anything to make sure I never have to experience that again.
Right.
But that's not how it works. And so I feel like a lot of the rhetoric that's going around this is very frustrating because there are people listening, there are people watching who are going through something like this. And I'm disappointed. I'm very, very disappointed that so many people constantly claim mental health advocacy, mental health awareness, and it's tough to come by.
Yeah.
It's really, really tough to come by. And it's very disheartening because I thought this would raise more awareness to be able to have real conversations about mental health in this country. People don't really seem to want to have that. A lot of people don't.
I'm hoping that the defense, what happens with the defense is, I feel like there's so many questions.
Mm.
And I hope some of them get answered. They won't all be answered, but I'm hoping that some of this stuff gets clarified. I think it is, my worry is this keeps people from getting help.
Yeah.
Especially women who are struggling after they've had a baby.
Mm-hmm.
I worry that because of what happened here, they're going to, these providers, Lindsay, all these people could have done all the right things, and we still may have had this outcome.
Yeah. That's what's scary about it.
Yeah.
Because that absolutely could be. And I think people don't want to believe that.
Yeah.
Because it's horrible to think that there isn't some quick fix and all she had to do was take the right pill, guys. No, that's actually not at all how any of this would have worked. And I think that really scares people. But if you are somebody who needs to reach out and I don't regret getting help and finally understanding what goes on with me and what I can do to help. I don't have to live that way. And also that it was only temporary. It's temporary can be a long time.
Right.
Okay. It can be months or years for some of us.
Yeah.
But there is hope out there. Now, no, you are going to find providers that you may not get along with. Been there. Both medicine wise, both therapy wise, and that's okay. Because, we're not all perfect matches. And this is such a personal experience that you want that connection with another person. So I still encourage people to go out and get help. One of the things that really helped me a lot besides medicine and therapy was my peer support group. I got the most out of that in the early stages. I mean, I've gotten a lot about all of my treatment. I've gotten a lot out of all of it. But to sit there with other people who are like you, who've been through what you've been through, who are all a little different, but there's a lot of similarities. And there were things I could say to them that I couldn't say to anyone else because either I didn't want it to be a burden. I didn't want them to think I was really weird. Because when you can sit in a group of people and just be like, yeah, I haven't showered in like a week. They're going to be like, yeah, been there. Right. But then if I go and tell somebody else I haven't showered in a week, they're like, and it's like, yeah, I wish I did shower, but I couldn't. Like what, they just instantly get it. And, it was so helpful all around to be around people. And this was not an outpatient group therapy session. This was a peer support. So it was a lot of people that were not in crisis, who had jobs of different kinds in the city. And it was great. And I really recommend anyone. They do them online now because of COVID as well. You can be anonymous because I know some people have jobs where sadly getting help is bad for their job, which doesn't make any sense because they have traumatic jobs, but that's a conversation for a different day. Don't even get me started on that. But there is help out there. It can be difficult. I am not going to lie to anybody and say that the journey is easy. It is not. I am now 8 years out from my diagnosis, and I've only felt like my self for like the last year and a half.
Wow.
Not that I wasn't getting better and things along the way, but because another thing that people I think don't understand who haven't been through it is that when you're in crisis, it's kind of hard to learn coping skills and stuff. Like there are many things that you kind of have to wait for that person to be at a certain point before they can kind of grasp or see. It takes time. It takes a lot of time. And, we live in a society that wants instant results. And the results are not instant at all. But you will see them.
Right. I will say this, the newer what's great if we're going back on, medications, boo hiss, for some people, they don't like the idea of the medicines. Newer medicines are faster acting. So the newer antidepressants, they're really making a focus on getting people feeling better sooner. And if that's not the medicine for you, at least we're not wasting a lot of time and we can pivot quickly.
That's good
And
news.
so, so a lot of the newer antidepressants are like that. I wish we'd come up with some newer mood stabilizers. For
there's
folks
like
who are,
2.
there's not a lot. I mean, there's a couple more, but they don't have good efficacy. I mean,
Mm-mm.
sometimes they work, but they're not,
Yeah.
and so I feel like we need more. I mean, lithium is still wonderful. I kind of wish Lindsay had some lithium at some point.
I'm not a medical, but even I was like, where is this girl's lithium? Where is her Lamictal? I think she was eventually put on Lamictal, but I was like, where are these?
Yeah.
Like,
now, I will
I
say
think
about the
kind of
lithium, though, I have a feeling she would not have stuck with the lithium.
Yeah, people have strong opinions about that. I don't really understand why. As somebody who's on it for a long time, I don't know if what they think it is. It's not. I mean, I've never been on anything. Maybe that's because my prescribers were always like, if you don't feel like you or a worse version of you, then it's not for you.
Right.
So maybe that's why. But I've been on very few that's ever been like, ooh, yikes.
Well, I think sometimes the lithium scares people because there's a little more oversight to it. I mean, you have to, monitor for some stuff like kidney and thyroid, that stuff. The lithium can kind of jack with that stuff. So you have to be careful. You have to watch your hydration status and all that. But nothing is more suicide protective. Nothing.
Yeah. It is, sometimes you gotta make some tough calls. But I feel like people think like all these types of medicines are gonna like zonk you out and be a zombie. Like, no. Well, and if they do, they're not the ones for you.
That's exactly what I tell people. I say, if I don't intend to zombify you, I don't want to take away your personality. If a drug does that, then we're not going to keep you on it. We'll try something else.
Yeah. I mean, there are some, but those are usually for crisis. And then after you're out of the crisis, you discontinue them.
Right.
But I think, and another thing too about Lindsay's case is people have been like, well, she didn't take all of her stuff like she was supposed to. Medicine compliance is very hard for somebody who is in a crisis. Because one, you're asking us to remember things when our brain's not working right. And also telling us all these sorts of things. But that's like one of the biggest problems with patients, I've heard.
I think so. And I think in Lindsay's case, from just what I've read and everything, is I think she had a lot of anxiety about even taking meds. I think, again, she might have had that personal stigma or, saw it as a character flaw if I have to take a med. And so I think she had a lot of resistance to it and anxiety. And, she... And when you're waiting for a medicine to work, especially like an SSRI, for example, and yet you're given like Ativan, a benzodiazepine, and it works instantly.
Sure does.
And you're like, well, I'm just gonna, although she had fear of the benzos too, which is,
reasonable,
very reasonable. But there was no doubt it helped. I mean, there's a reason why we do use Ativan for people for acute mania to try to, knock people down, get them some sleep so that we can get that under control. They should be for emergencies. And so, but when you take one of those and you're like, ooh, I'm feeling better. Cause I think anxiety was a big part of what she was going through. I think we are underestimating what the anxiety's part was in this. That's what I think we're doing.
Anxiety can get so bad. I couldn't leave my house for 3 years.
Right.
Like, I do think that is one thing that is being like how crippling
Yeah.
it can be. It
Mhm.
is some of the worst, I think.
Mhm.
Anxiety is the worst.
Mhm.
Depression, once you get to a certain point, you're too
Right.
apathetic to really care, right?
Right.
Once you're kind of like in, because that's another thing I wonder if they'll bring up is if they are going, well, she might have had a bipolar episode we didn't know.
Mhm.
There's the dangerous come down period
Right.
between the two. Was she in that danger zone there? Because once you get to
Mhm.
a certain point, it's kind of like,
Yeah.
well, you're probably fine.
Yeah.
You're not fine, but you're
Mhm.
not. Anxiety mixed with mania or depression is
Right.
the most dangerous time.
Right. And then, I'm sure if was any sign of a manic episode in the days or weeks before, I'm sure that'll come up in the defense, because certainly people can crash hard.
Mhm.
Um, yeah, I'll be very curious to see what her providers that have treated her since then have said. Yeah, hopefully some of these questions will be answered, or maybe not. Maybe it'll just be more murky. But I
Yeah.
think she had certainly obsessive anxiety at times. And so my thought is, I mean, it's hard to know. Was it depression? Was it bipolar? Was it OCD? Was it, we know in her past she had almost an obsession with like exercise and
April
beach
asked,
body.
I
Yes,
started this
they
for
can.
later.
Yeah.
Because April had that question. Suicidal ideation can be common in a lot of things, unfortunately.
Absolutely. You can have those in OCD.
Yeah.
And certainly I will say this, she could have had if she had an existing undiagnosed OCD. You don't have to have compulsions for OCD. You could just have the obsessive.
Just the obsessive component
Yes, you
and the
can have that now.
paranoia.
Mm-hmm.
Oh, okay.
So certainly postpartum OCD or postpartum exacerbation of OCD is more common than psychosis.
Oh, okay. I've
Definitely.
never talked about. I never knew that.
Yep.
Huh.
And so, that being said, you can have depression, OCD, and psychosis, or you could
Mhm.
replace depression with bipolar. You can have all of these things at once.
Mhm.
We don't have to settle on one thing explains all either.
Right. Do you
So,
think that's where people are kind of losing the plot is they do want that one answer,
yeah.
but unfortunately there isn't.
There isn't. There's not even when you're looking at what we know already, when we're looking at what has been, what the prosecution has brought up is, yeah, I'm seeing some mistakes that Patrick made. I'm seeing
Yeah.
mistakes that providers made. I'm seeing mistakes that Lindsay made. It's not perfect. There's not an aha moment where this is what caused this. I know that people want this because we want to
Mhm.
be able to fix it so it doesn't happen again. And it's easier when it's just one thing with big neon signs pointing to it saying,
Yeah.
aha. And we're not going to get that here. We're just not.
No.
It takes a village, unfortunately. And
That's
I
true.
think it took a village for this tragedy.
I would agree. I know that's not what a lot of people want
Yeah.
or want to think about, but
Mhm.
it's kind of again a perfect storm
Mhm.
of tragedy all around, and it's not like I said, it's not a rarity.
No.
Unfortunately, I would love to be like, oh, this is a one-off, but it's not.
No. And it's not as cut and dry to say Andrea Yates. That one was that was textbook
Well, she got
to a
2
degree.
trials. So even the first one, they voted her
Yeah, that's
guilty,
true.
and then she had to get another one for that. I do
That's
think her
true.
case was a little bit more clear, but that's
Mhm.
only because she had a longer psych history than it
Right.
sounds like Lindsay had.
Yeah.
Um, but I think that, I don't know. I don't know what the outcome's gonna be here because I think Well, one, I do want to hear what the defense has to say,
Mm-hmm.
of course, but there is so much stigma around
Mm-hmm.
all of these things that I hope the jury feels like they can make a reasonable decision, whether it's guilty, not guilty, I
Mm-hmm.
don't know. But this is something, bias that I think many of us have. I think she was suffering from it. I know
Mm-hmm.
I have. I know many others have, even
Mm-hmm.
watching this unfold. I've gotten a lot of questions from people I know about these things just because they know about my experience. And I'm just like, I
Mm-hmm.
don't know what to tell you. Like, the system's not great.
Yeah.
All right. We're not going to sit here and pretend it is because it's
Right.
not. People fall. Lindsay was just not a one off that fell in the cracks either.
Mm-hmm.
That
Absolutely.
happens a lot. People do lose their lives to mental
Mm-hmm.
illness every day.
Yeah.
Um, how does it get better? We don't know. And this is another thing I've explained to the people that I talk to. Psychiatry and mental health is really still in its infant stage.
Mm-hmm.
We have not been doing this for very long on what is the most complex part of our entire body.
Yep.
It's really not that old. So I don't know why we're holding these super high standards of we've got it
Mm-hmm.
solved when we don't. Like, that's not
Right.
how it works.
Yeah, we're getting so much more information with the advent of functional imaging, where we can,
Mm,
actually see what is lighting up, so
yeah.
to speak. It used to be, we studied the brain post mortem, and that
I just
didn't
talked
tell
about this.
us. Yeah, it doesn't tell us about what's going on, just what's there
Or not there,
or
which
not
isn't,
there. You're right.
it doesn't say
So,
much.
now that we have functional imaging, not just in humans, but also, in rats and stuff like that, and we are getting a better idea of what the causes and how to treat certain mental illnesses, from that, and better idea of what, the 25 seconds of how a drug could kill you and 5 seconds of how it could help you.
Mm,
We're getting and we don't quite know how it works. Well, we're getting a better idea now because we're able to give, in the lab, these medications and see what's going on in the brains so that we can have better better medications that have fewer side effects, that target specific areas and work faster too. We're coming up with non-medication options, such as, we're still using ECT. It's a
mm,
fine
mm,
option for some people. TMS is certainly growing. There's a place for ketamine. There's going to be a place for psilocybin and MDMA. I
mhm.
think the other psychedelics someday will be approved, though in some states they're already being used. Just it's not recreationally. We'll say therapeutically,
Yeah.
used therapeutically. Um, so it's really an exciting time to work in this field because we're seeing new things. We have the first real novel antipsychotic has come out in the last couple years, one that doesn't have the same potential side effects that older antipsychotics had, like the movement
Like
related side effects,
yeah, the
the tardive
dyskinesia.
dyskinesia. Yeah,
Yeah.
doesn't
I've
have that
seen
because it
that.
works on a totally different system. So this
Mhm,
is wonderful, and it actually treats the negative symptoms of schizophrenia. For those who don't know, this the
oh,
negative symptoms, kind of the blankness,
mhm.
the just being there,
Affect
existing, yeah,
or
the affect,
mhm,
the depression, things like that. I mean, our previous antipsychotics can work on the psychoses, but not
mhm.
so well on those negative symptoms. And that's been a big problem. So now this new medicine does help for some people who do respond to it well. It can help with those. So that's exciting. So there
That
are new things coming out, and new things. So I guess what I'm telling people is when people in the patients I have lost, one of two things have happened. It was a snap decision, usually because of a substance or just a situation,
mhm.
or they lost hope. It was a choice. They decided to do it because they felt there was nothing left to help them.
Absolutely.
And it would take a long time for someone to exhaust all the options we have now in treating mental health. And so for those who, are just now starting to get treated, and for those who have been fighting whatever they're fighting for a long time, there's always something new. There's always new data. We're even finding new uses for old meds that we didn't know could help before.
Yeah, I've been on some off-label
Yeah.
for things. I'm doing what Prozac, or it's for dreams.
Prozocin.
Yes.
Yeah.
Yes, I haven't taken that recently because I wasn't used to dreaming, and I can't stop dreaming, and it's awful. I don't sleep well.
Oh, gotcha.
So that's helped me like feel a
Yeah.
little bit more rested. Dreams haven't went away, but I do feel more rested
Good.
anyway.
Good.
But that's for blood pressure or something like
Yeah.
that, right?
Absolutely.
But I think too, another part as an experiencer over here of the whole help thing is that isolation is the one thing that we talked about a lot in my support group, was that it was isolation that got a lot of us there. Because you can't talk about it. You can't, or you may not be able to talk about it with most people, or you don't know how so you're just isolated. And the more isolated you got, the more those thoughts were allowed to go further.
Right.
Because you feel like nobody's listening, or maybe you can't communicate, or, stigma, quite frankly. But that's why I suggest peer support groups for people.
Right. Plus, it's a form of distraction, and distraction can be a very mature form of coping.
Absolutely.
As long as you come back to your problems, distraction's good. I mean, if you're alone, if you're isolating yourself, it's just you and your thoughts, that's just going to make you dig deeper into the hole.
Absolutely. I think it's one of the most dangerous things that you can do. But also, I think people don't realize that also during all of this treatment is, listen, there's not a cure for anything yet, right? The medicine is to help the symptoms. You also need other things as well. And that's why it takes time, right? Because the medicine's going to maybe help get rid of some symptoms, but you still got like some coping skills, some triggers. Maybe you need a wrap plan. You can tell I've been through all of the things because I was like, oh, okay, I guess we're going to take this seriously. But I do still, anybody that's been watching this trial, do reach out to help in some way, shape, or form. Maybe you don't want to do medicine right away.
Right.
Okay, let's go talk to somebody then.
Yep.
You got to start somewhere, and it's okay. And it's okay also to not be okay. I think that needs to go further out into, it's okay to not be okay. I know, I had a young son when I started my journey, and obviously I basically had to live in bed for a very long time because I can't get out of, I'm so, what's the word when it gets really bad? I can't get out of the bed. I can't bathe myself. I can't eat. It's really, really bad. And, that's hard when you're a mom of a young child. And so I had to figure out a way to make that work, right? So I did talk with my child, and this is, everybody can do whatever they want. But for me, well, one of the things when you find out, that you have bipolar disorder, you do worry about passing it on to your children, other illnesses as well, right? And so we did talk to him about how, sometimes mommy's brain gets sick, and that's okay. And, we would do things like watch TV together, and, we would do stuff that we could do in the bed, so I could still kind of participate.
Yeah, that's a great idea.
As I was teaching my kid, oh, mommy's brain is sick, it allowed me to be like, yeah, my brain is sick and that's okay. Like, it's
Mm-hmm.
okay that I am not well right now. I wouldn't feel well if I had the flu and was throwing up in the how is this
Mm-hmm.
different?
Right.
If honestly, I think it's worse. It's the other stuff that you get over real quick.
Right.
But I think changing the way people look at it as
Right.
well. I don't like that mental health is separate from
Mm-hmm.
our other physical health. Why is that? I don't understand why that's the
It
case.
shouldn't be. I think it's because there's just, there's been so little. I mean, the brain is still such a mystery. And part of that is because we have this big barrier between the rest of our circular, we have this thing called the blood-brain barrier.
Right.
A lot of people are like, well, can't you just draw a tube of blood and tell me if my serotonin's low? I see Quest has a serotonin level test.
Mm-hmm.
I'm like, well, here's the problem is seeing how much serotonin is in your bloodstream doesn't tell me what's going on in your brain because of that blood-brain barrier. Yeah.
Your tum-tum.
Yeah. So, we can't just draw a tube of blood and know what's going on in your brain. Now, in some cases, we could do a lumbar puncture and look at your cerebrospinal fluid, but we don't do that routinely because that's very risky.
Yeah, I was going to say, that's spinal tap. No, thank you.
Right. So, I get that people are wanting something solid, something tangible. And I think that's the problem with mental health conditions is that we don't have solid diagnostics for it. We don't have anything tangible, where a lot of things you have tangible things to help reach your diagnosis. And what we do have is this categorization of symptoms into categories that we call the DSM-5 that also tells us nothing about why these symptoms are occurring. It just is telling us this cluster could be this, but it's not telling us why. It also, is very imperfect, I think, because people, I question, I have a love-hate relationship with the bipolar criteria because they've got these time limits on how long mania and hypomania are to qualify. And we're starting to think that maybe people aren't little boxes and that maybe we should treat someone with bipolar type medicines even if their mania is 4 days instead of 7. Maybe what they need is lithium instead of Prozac, so to speak. Maybe we should jump to that. Maybe the criteria is too stringent and we need to think about that. And so I do tend to, if I suspect bipolar, I personally am a little more aggressive in maybe switching to that approach if their depression has been resistant. It's like, well, maybe it's not depression. Maybe it's bipolar.
Yeah.
So to speak. But I think that it's a very imperfect thing. And I think because of that, we are not considered medical, even though we are medical, and medical things can make mental health worse. That's the whole thing behind postpartum syndromes, depression, OCD, psychosis. These are, hormones influencing that. And that's why our first postpartum depression drugs are neurosteroids, pregnenolone, allopregnanolone. It's a hormone.
Okay.
To help.
Hormones are wild after, well, one, they're wild in general.
Yeah.
And then after pregnancy, it's.
Yes, it's all over the place.
Wow.
I mean, we see it in we see a little microcosm, millions of women with PMDD, although they changed the name of it and I can't remember it now, but premenstrual dysphoric disorder or PMS. This is a mini postpartum depression every month in women who suffer from it. So it makes sense that some women would experience it on a grander scale after they have a baby, which is traumatic for the female body.
Absolutely. And then you have so many different things that like explode, like chemical wise happening in order for that birth to happen and after. Like
Mhm.
I can see how it can be very easy for that to
Right.
just kind of
And
happen.
and also that just reminded me of something. So in Lindsay's journal, she mentioned that she stopped breastfeeding Callum.
Okay.
And she also didn't feel she was bonding with him. She was there's obviously not everyone who doesn't breastfeed has this issue. I mean,
Hmm.
but we do know that my thought is we do know that breastfeeding releases hormones that make us feel better and make us attach and make us bond. Oxytocin,
Right.
prolactin, other things. Now, obviously, there's plenty of women who bottle feed and they don't have this issue. But in someone who's already struggling,
Hmm.
you add that on that I'm no longer breastfeeding and no longer getting that delivery of these hormones that improve my mood, that could also lead to a crash.
That's true.
That just occurred to me.
Or the act of not feeling connected with the child.
Right.
Like what that has to do to your
Right.
psyche has to be
Right.
awful.
Yeah,
Because
and
you
she's
know
like,
that's not
what's
right.
wrong
I
with
love
me?
my other, yeah, like
Yeah.
I can't imagine the mental battle
Mhm.
that I would have had every single
Yeah.
second of the day.
I
had
have
that
a lot of sympathy and empathy for her. You know, when this first started, I thought maybe she was doing something what we called malingering.
Right.
I have
You can
changed my
explain. People
mind.
may not know what
Oh,
that
sorry.
means.
Malingering basically means she's making this stuff up
Mhm.
for some sort of secondary gain.
Right.
I no longer think that. That is not to say that I believe her 100%, but
Mhm.
there is no doubt she was depressed.
Yeah.
There is no doubt, you know, I don't know that she was actually psychotic. The jury's still out, no pun intended. You know, I'm not even convinced she's bipolar. I know
Mhm.
she had severe depression. You know, I think it is making it easier for me to accept. I'm okay with the jury. I don't know how they're going to come to a unanimous decision on anything, to be quite honest. Either way, I just don't.
True. Could be a mistrial.
Could
Probably
be a
will be.
mistrial. But if they do come, I mean, I think I'm okay with either the prison or commitment.
Mm.
Either way, because there's no doubt that she was acutely ill.
Mhm.
That's for sure. And she could probably benefit from the commitment.
Yeah, I will say that everything I've learned so far, like I've just been like, yep, that
Mhm.
sounds about right. Yep, that's pretty accurate.
Mhm.
And I've said to other people, I was like, I saw literally nothing alarming. And then I had to be like, oh, wait, hold on. I know it looks alarming to you guys. And it
Mhm.
is. It is alarming, but it also seems pretty standard point of
Mhm.
view from having gone through that.
Mhm.
Because you can kind of tell when people are full of shit. You're like,
Mhm.
that's not even how it works. Even
Right.
if we all have different experiences, you're like,
Mhm.
that's not it. But I will say most of it so far, I'm like, yeah, that checks out. Now, whether or not, as you said, it reaches the level of
Mhm.
insanity is going to be up for debate heavily. But now I'm curious because of the Massachusetts law there. But
I haven't
mm,
looked up why they decided to have it be that way. There had to have been a reason for them to put the burden on the Commonwealth rather than the accused.
yeah, because it's always the other way. Like if you're going to do it, then you have to prove that you were unwell.
But I feel like
But
this case is showing what's wrong with that. Not that I think the prosecution would succeed if it was
mhm,
reversed. I just don't understand how when we're talking about hallucinations specifically, how the prosecution proves she was not experiencing hallucinations. So that brings up the thought, is that hypothetically, for the sake of argument, if she's making up the psychosis, if she's making that up, this is for the sake of argument, it would make perfect sense why she would choose auditory hallucinations. It's not provable that she didn't have them. Doesn't mean she didn't have them. But if I were a malingerer, that's what I would choose.
It's fair. That makes sense to me. That makes a whole lot of sense to me.
But like I said, I don't know. I mean, I am open to the evidence. I've already changed my mind. I mean, I went from thinking maybe she's a malingerer to thinking something happened here, but does it meet, the standard of the law? I could change my mind again.
How do you? I don't think you mentioned. How do you think the law regard should be changed in general regarding mental health and using the insanity defense? Were there any changes about it that you think should be taken into consideration? Because I feel like just knowing the difference between right and wrong isn't quite enough with all we know now. Because I think it's so much more complicated than that.
I mean, certainly, like in the let me use an example of mania. People who are really severely manic literally struggle to control what the heck they're doing. Like they many times they cannot be controlled. They can't control themselves, and it's hard for others to control them. For a lot of people with mania, mania is a perfect example of if someone does something while in a confirmed manic episode, I feel like that should qualify for getting off on that.
That's what I would think.
Yeah.
But then again, then we have the right and wrong.
Right.
There. Like, yes, I do know the difference. Because it's kind of like, I describe it to people as like, I'm on a party train. And if you are not going to be on this party train, then you need to get off. And it doesn't. Now, that's not meaning I'm going to be making good decisions.
Right.
But I'm also not able to resist to use that that word.
Right.
But I mean, some people do much dangerous things during that time, but I don't think that would be enough under the law.
It's a difficult it's a difficult decision because, or it's a difficult thing to say if there's something better, because
that's right. You better not tell me that I'm manic. I will be like,
yeah,
you don't like me.
Yeah, I don't know. I don't know how I'd change it. That's something I'd have to think about. I mean, certainly people who don't understand right from wrong, well, when it's obvious, it's no brainer. In the case of severe intellectual disability, they just don't have that advanced critical thinking or reasoning, and they may have the problem solving, they may not understand consequences. They may have be at a level that is much below their age, and they just don't understand. In the case of something like this, I mean, I feel like, I don't know, the bar. I mean, certainly if someone is having a delusion, and certainly people who have an actual psychotic delusion, they believe the delusion. They believe it. They believe they're married to Brad Pitt. Yeah. Even though they've never met Brad Pitt. They believe they're married to Brad Pitt, and no one can convince them otherwise. And if they go breaking into Brad Pitt's house because, well, it's my house, that I think is a clear sign, and that they believe that it's as real to them as anything. I mean, I've experienced visual hallucinations in my life as a medication side effect.
Oh, okay, yeah.
And it was not. It was. I was having a good old time. I was not disturbed by it at all. My parents were disturbed by it, but I was not disturbed by it at all. but it seemed real. It's like, wow, you guys have 5 TVs now? That's 5 TVs. What?
Right.
But I'm like, interesting. And I keep chopping up the lettuce for dinner. So when someone is truly psychotic in general, I don't want to say truly psychotic, but in a lot of psychotic states, you're believing it. Maybe not initially when you first start getting it. Like, I can believe if she had a first time auditory hallucination that day and it freaked her out and it was strong and it was this male voice. She's like, oh crap, I need to do this. This is my chance. Okay. That might be a good defense where it's like, I think that's where they're going. But, it's really a judgment call. And I hate to say that because that's so much of psychiatry is judgment calls. And like, I look at these providers who said, I don't think you're manic. I don't think you meet this criteria, blah, blah, blah. And people are like, how could that? I wasn't in the room with her. I mean, in general, when someone is manic, you pretty much know. If you're trained to identify it, you can, even on the television, Mr. Reddington, you can, even through your virtual television visit, you can identify someone who is actually in a manic episode. Now, sometimes, we can have the hypomania and mixed episode can be a little more tricky.
Right.
But a lot of times providers, that face to face, even over virtual, even over Zoom, we can usually tell.
Yeah, it's kind of like your brain just decided to give you all the drugs.
Yeah.
You very much can tell. Now they don't know.
Right.
And maybe even those around them don't really understand what they're seeing. But
no, but
they
they see something different.
Yeah.
They see something out of norm.
Absolutely.
Yeah.
And that's the thing, right? So what is the baseline called again? Eurythmia, right? Is that
euthymia?
Euthymia. Thank you.
Mm-hmm.
So if that's people's general baseline, right, using the scale of things, and they're between the ones. So when you get people to like the 4 and the 5s on both ends, that person isn't even close to being in their normal state. So how is that not a form of insanity? Is what I would argue for the law side of things, because I'm up. And let's also say this for people that don't know this. Listen, you can be in these states and be fully functional.
Yes.
I ran a business for quite a while.
Yeah.
Then I had to close it because I came down and it was all very, very bad time. But you can be a functional, quote unquote, human being. Whether you're psychotic, whether you're depressed, people do it all of the time. I don't think that takes away. I think a lot of people want to think, oh, psychosis, things like that, like it's in the movies, and I'm here to tell you it is not.
People
think
they think schizophrenia. When they hear psychosis, they think schizophrenia, and schizophrenia is just one disorder that can have psychosis be a feature. Now, it's a very prominent feature of schizophrenia, but depression, OCD, certainly I've seen it. It's not really a feature, but I've seen it. Bipolar disorder can certainly have psychotic features. You can have a paranoid personality disorder. You can have just a delusional disorder. You can have delusional parasitosis. You can have, usually because of meth, but still,
drug-induced psychosis is a very real thing as well.
Yes. Oh, I forgot to we do know Lindsay started using marijuana at some point in there.
Okay.
Marijuana can cause psychosis in some people.
It can. And also, listen, I participate as well to sleep and eat in the evening. Because when you suffer from anxiety long enough and you don't weigh very much because you're not eating, it helps.
Right.
However, I know in my support group, because I had been a user for a very long time, some of the others weren't, but it was around the time where they were talking about medical marijuana for things. And
Mhm.
I was just like, I'm telling you though, be
Mhm.
careful
Right.
because you don't know. Like
Mhm.
I can't go out in public. My
Mhm.
paranoia, the
Mhm.
worst. Um, and I was like, so you don't know what you're doing. So please be very, very careful with it.
Yeah.
It's not marijuana is marijuana. It's not,
Mhm.
to me, it's not that big of a deal, but it really can be
Right.
in certain circumstances. Like if you're not in
Right.
a well state,
Yeah.
I don't know if you should be doing that.
Yeah. It can cause psychosis. It can make psychosis worse. It's a depressant.
Mhm.
So if you do too much of it, it can certainly make depression worse.
Absolutely.
Not to mention what it can do to ADHD. I mean, I'm not saying that marijuana doesn't have some therapeutic uses, but I will
Sure.
say this, the marijuana in general that is out now is not, Woodstock era marijuana. This is concentrated, high potency. We are
Girl.
we we are seeing worse issues, more side effects
Yes.
from marijuana today. Now, if you're in one of those states where you can grow your own and you're just smoking a joint, then that's, going to be cleaner, obviously, and not as potent. But when I hear of people, using concentrate and, and smoking concentrate, what you should be doing, if you're going to be doing any, is ingesting flour.
Mhm.
Ingesting flour is probably the safest way to use it.
Oh,
But
yeah.
I don't know the method or strength or anything. I don't know what Lindsay used, but just that the fact that that's in there, I'm like, I mean, she probably did it for sleep. She probably used it for
Probably.
sleep.
But it can also be bad for your anxiety,
Right.
depending what kind of environment you're in.
And your
I know it can.
strain and,
But
and stuff like that.
all these people that don't have like a history of use, when they tell
Mhm.
me what they're doing, I'm like,
Yeah.
are you serious? Or
Right.
what? What are you doing? I'm clutching my
Well,
pearls.
yeah.
I'm like, you are wild.
Right. And what if she hadn't used it before? What if she was
Yeah.
not using it all and she started using it for her
Mhm.
sleep in this time? She could very well have been using way too or
Way too much.
way too much,
Mhm.
but again,
It's
she
not even
was
like I've been to like a weed store, right,
Mhm.
for medical, and they're like, "Oh, take this much," and I'm like, I don't even know what this means. Like, what? Do you want this is like 5
Mhm.
milligram? I'm like, I don't even know how much I've been
Right.
smoking for the last 20 years. I
Mhm.
don't know how much
Yeah.
is in a joint, and then they'll give you the joint, and it's like this big and huge, and I'm like, whoa,
Yeah.
what is that? What is what is this? And then I
Right?
realized a bunch of people have been taking all this who probably didn't
Mhm.
have a lot of experience.
Yeah.
And I'm like, well, damn,
Yeah.
what you doing?
Yeah.
Let's calm down a little bit
Mhm.
there.
Yeah.
But no, that is something that is
Yeah.
very talked about.
Yeah. So, I mean,
You have to be careful.
her use of it may have had no difference. It certainly didn't help.
Sure.
That I know, but what did it make anything? I mean, I don't know. We may hear more about that when not from the defense, but when the defense witnesses are cross-examined. That
But
could
did they
always
say
come
how
up.
much it was?
I can't
Was it in our
remember
even
where I
system
saw it.
or?
I don't know.
But no, that is something
Mm,
they warn people with all sorts of mental
mhm.
health issues is to be careful. And that's just being responsible, right?
Right.
It's no different than other parts of like your routine that you have to put together, like your sleep
Mhm.
hygiene and all of that
Mhm.
crap. That works. It works.
It does.
You can fight it, as I
Mhm.
do, but they're not wrong. And you're like, damn it, Claudia, I wish you were wrong. But otherwise, no, it's important to think, just like
Mhm.
drinking alcohol. You drink alcohol every day, it's
Yep.
probably not gonna be good for you in large amounts.
Right.
It's about moderation.
Yes.
Um, but yeah, I
Well,
could
she was
see both
drinking
sides.
too a lot, and that's a depressant.
Well, and self-medication is
Mhm.
so real when
Yeah.
you are in a crisis because you
Yeah.
want it to stop. And unfortunately, too many people use that, and then it becomes
Mhm.
a really big problem.
Yeah.
Um, So I get it. I actually don't
Mhm.
really I get wanting to use drugs or alcohol.
Mhm.
It's not good. Don't do it. That's
Yeah.
how you end up developing problems.
Mhm.
But that need, though, for me, sometimes if my state was too bad, none of it worked.
Right.
I could sit here and drink all day and just be still sober by the end of the day. It just
Mhm.
wouldn't do anything.
Mhm.
Um, so, but that's very common in people too, self-medicating. But then I don't know. It's just, it just makes me sad. It
Yeah.
just makes me all so, so sad. And then, she has to live with this
Mhm.
every day. She has to live paralyzed
Mhm.
every day. I still think if she had her choice, she wouldn't be here anymore.
Well, and
Um,
that's one thing to consider, if she happens to be committed. So let's say that she's found not guilty by
oh
reason
yeah,
of
can we talk
insanity.
about what does happen there for people
Yeah.
to understand? Because I think some people don't
Mhm.
understand. It's not what they think
Right.
it is.
So, from what I understand in Massachusetts, is she'd have a mandatory 6-month commitment. And then at the end of the first 6 months, there's kind of a determination. The providers at the institution kind of determines, do they think she's ready is she no longer a danger to herself or others? And apparently the prosecution or the Commonwealth can lodge, each time it's proposed, they can lodge an objection if they
It's like
decide.
parole.
It's like a parole. And then after that first 6 months, it's then every year where the same thing happens. So there is a chance that she could be out in 6 months. Chances are not.
Mhm.
Most of the time, when I think the average is like, I thought like I saw like the average was like 16 years where people are actually committed after this. So typically people are not, discharged that soon. Chances are she's going to be spending years committed for this. And I would still imagine, I'll be honest, even after that time, she's probably at a high risk of unaliving herself at any time she's released,
Mhm.
to be honest.
Yeah.
So when I look at it, I'm just assuming she's going to be suicidal upon release, no matter when that is. I don't think, and this is where I feel like I'm okay if she's committed. I don't I don't feel like she's a danger to society,
Yeah.
but by and large.
Mhm.
I don't think she is. Plus she is paralyzed. So, there is a limit to, even if she was, that, unfortunately, she's kind of in a prison of her own making
Mhm.
anyway. And so that's kind of where I've come. I'm okay no matter which way it goes. I have a feeling it's going to be a mistrial, and then what the heck do we do?
Yeah.
Honestly, I think
Well, it's Massachusetts. They'll probably do it again.
I
Oh,
think they should try to put a deal together to where maybe she agrees to a longer mandatory commitment, not 6 months, but longer.
for
And
the inpatient, can they
yeah,
do that?
I don't know, but
'Cause
apparently, I've heard they can still make a deal. If there's a mistrial, they
Mhm.
could still negotiate some sort of plea deal or some sort of deal like that potentially. I mean, I don't know if that includes being committed or if it only includes prison, but
Okay.
I feel like
I feel like
you
I've
know,
heard that before in a Florida
mhm,
case.
yeah.
It was with a guy, a young
Mhm.
guy. Oh, I think he's the one that ate his neighbor's face.
Oh.
Um, he ended up doing an insanity deal and got committed
Mhm.
from that. I can't remember his
Yeah.
name, but yeah. But that's Florida. I don't know how it is
Mhm.
in Massachusetts
Yeah.
because some things has to go in front of a jury no matter what.
Mhm. Yeah.
I don't know if that's a thing, but
Yeah. Yeah. I don't know
uh,
the nuances as far as if there's a mistrial, but I think yeah, there's a possibility. I just don't know if being committed can be negotiated outside of a trial.
yeah, I don't know. It's an
Mm,
excellent question.
mm,
Um, Now, if you are committed, what kind of
Mhm.
things happen? Is it any different than a regular inpatient hospital? Besides, there's lockdowns, obviously.
Right.
But what treatment would she be getting there that would make it
She would
ready
probably
for her to get
get
out?
intensive therapy, individual and group, medication if she's still depressed, which I'd assume. I mean, they would probably have access to things like ECT or TMS. It would probably, if they're still unclear on diagnosis, give them that time. I think stuff like that. So, it's not. I think there are some people for whom they're probably not going to get any better with
Hmm.
with being committed. It just depends on what the condition is.
Yeah.
I think in her case the answer is yes, except I just don't think she's going to want to exist out in the real world.
Yeah. I mean, she could be like Andrea and just stay in there. Because that's Andrea
Mhm.
Yates' deal.
Yeah.
She could have been out a long time ago,
Mhm.
but she doesn't even
I
like
mean, she probably
try.
could.
She
She could
stay
say,
there.
I don't feel
Hmm.
safe. I don't feel ready. I'll just stay in here." And that's
Oh yeah.
fine.
Well, she's turned down
Mhm.
every time she could. She's
Yeah.
she's turned it down, is what I've heard.
Mhm.
Um, you know, it's I don't know what you would do there. But those are some very interesting
Mm.
legal questions. I wish I had answers for those, but I
I
don't.
don't either.
Um, certainly, certainly very interesting. Well, yeah, Andrea does not want to be released. And as I've had these thoughts before of what happens if something happens where I can't control myself, or let alone in their
Mhm.
scenario when they've done something
Right.
truly horrific. How could I trust myself to be around anyone
Mhm.
ever or myself?
Right.
I can't. It's already a lot of mental gymnastics to
Mhm.
begin with for yourself,
Mhm.
let alone that
Yeah.
added on there. And quite frankly, how is she going to afford care if she wasn't in there?
Right.
I mean, we already talked about how insurance isn't great,
Mhm.
let alone with how many things she has wrong with her now.
Yeah.
Um, well, I want to thank you for coming on. We're going to
Oh,
wrap it up because it's like
yeah.
10:30 my time, and I know
Yeah.
you're a few hours behind me, but girl
Yeah.
is tired, and I got a show in the morning.
Well,
um,
thank you for having me on. Thank you for inviting me. Mhm.
Absolutely. I would love to talk more. Maybe if there's some witnesses that anytime you want to
Yeah.
come on and talk and have some real conversations about the reality of things and how they can work, especially with the defense's
Mhm.
cases. Do we know, is the state close to wrapping up yet?
I think they're anticipated to wrap early this week.
Early this week? I
I
thought
think
I
so.
saw something about that, but I didn't read the
Mhm.
article. It's just the headline, and you can't trust those.
No.
You can't trust those. So I keep meaning to ask somebody like,
Mhm.
oh, okay, all right. But no, thank you so much for being on today, Maggie, as well. If you guys want Maggie back, let her know. I'm sure she would love to answer more questions. As we said, though, this is a truly tragic situation.
Mhm.
Um, there is a lot of things that probably could have been different.
Yeah.
But even if they could have been different, we don't know if it would have been enough. I know we want to believe that it would have, but we just don't know. Um, but please be wary of internet conspiracies and
Mhm.
misinformation. All right. I have loved the amount of people that have been asking questions and wanting to know more because they can't put themselves in Lindsay's shoes mentally with the despair and desperation. And I have seen some people say really, actually nice things.
Mhm.
Um, and so that is nice. But, there are lots of people out there watching who have gone or will be or are going through a crisis right now. And what you do say online matters. It does. somebody will see it, and your comment could be either could help them get help or make them not want to get help. So try to be the one that says it's okay to get help, and that it's okay to not be okay. But with that, is there any parting words, Maggie, you got for anybody before I sign us off here?
I would say be kind, be curious, and be open-minded.
Oh my gosh, it's like my mantra. Gosh, Maggie, we're like besties already. I love it. All right, friends. Well, thank you all so much. I will see y'all tomorrow morning, 10 a.m. Eastern. What are we doing? Bricks and minifigs, police body cam videos, doing murder stuff in the afternoon over on True Crime and Wine Time. Oh, and then I have my son's high school orientation in the evening.
Oh.
Gross. I don't like it.
Oh no, they're
but
growing up.
I don't like it at all, but it's okay. All right, friends. As I always say, until next time, go forth and be amazing. All right. All right. Bye, friends.